or go hungry altogether. I've always said that it's expensive to be poor in America, and unfortunately, that's still true. But more and more, it's expensive to even be middle class in America. Family budgets are being stretched thin, and my goal and the goal of this committee is to examine this reality and to discuss how this leaves many families left to worry every month about whether they will be able to afford quality, healthy foods. Because hunger doesn't happen in a vacuum, and it's going to take a holistic approach to solve it. That's one of the reasons why the mission behind these hearings is to create a volume of information that we hope to turn over to the White House for the White House to do a White House conference on food, nutrition, health, and hunger, to look at this whole issue holistically, connect the dots, and to not manage hunger, but to come up with a plan to end hunger once and for all, and also understand the link between food insecurity and nutrition insecurity. So I'm grateful to our panelists. I'm going to introduce you right now. Sometimes I speak Massachusetts and I mess up people's names, so please correct me if I mispronounce anybody's name. But let me introduce our witnesses. Miranda Klugaser, am I correct in that? Okay, who is the director of the Kansas Alliance for Wellness, where she supports local food policy councils and alliance partners across the state. Sarah Sadian, right? Am I saying that right?
Sadian, thank you.
Sadian. Okay, well, okay, close. Sarah Sadian, who is the Vice President of Public Policy at the National Low Income Housing Coalition. She brings her experience working on housing and rural development issues to this role. William J. Barber III is the founder and CEO of the Rural Beacon Initiative. He has ample experience in social justice organizing and environmental and climate justice advocacy. Jamila Michner is an associate professor of government and public policy and co-director of the Center for Health Equity at Cornell University. Her research focuses on poverty and racial inequality. Robbie Mackinnon is the president and CEO of the Kansas City Area Transportation Authority. He has led dramatic transformation of the region's transit system so that it works better for the entire community, including those with disabilities. Cliff Johnson is the director of the MacArthur Justice Center at the University of Mississippi School of Law. Under his leadership, the center has successfully litigated cases challenging practices such as the widespread use of illegal and excessive bail, among other social justice issues. And I'm grateful to all of you being with us here today. And Ms. Klugaser, I'm going to start with you, but I understand that you recently got married.
I did, yes, last Saturday.
And congratulations.
Thank you.
So my staff tells me that you are joining us from your honeymoon. I don't know if that's the case, but is that right?
It is, yeah. So you might hear some weird birds. I'm not in Kansas right now.
Okay.
I'm in Hawaii on the Big Island. So
Oh,
I
good.
am.
Well, first of all, we are so grateful that you are taking the time to join us for this discussion, and you are now recognized to share your testimony with us, and any wedding stories as well are welcome. But anyway, I'm happy to yield to you first.
Wonderful. All right. Thank you so much, Chairman McGovern. And I also want to thank Ranking Member Cole for the opportunity to speak to you today. So the chairman said, my name is Miranda Miller Klugaser now. I'm the director of the Kansas Food Action Network. And while I'm happy to field any questions today regarding my own subject matter expertise or the anti-hunger and other food insecurity and food system work my organization is pioneering in Kansas, rather today, I'm here to provide testimony that really only comes from lived experience. You see, before I directed a statewide organization, before I had earned 2 master's degrees or was named a Mitchell Scholar, before I was a first-generation college student, I was the oldest of 3 kids in a family that sat at or below the federal poverty line for the better part of 25 years or so. And while I'm thrilled to say I no longer live with such grave financial restrictions, I want to emphasize that my testimony today and everything I'm about to say is the exception, not the rule. The reality is that I shouldn't be sitting here before you today. The odds were against me, as they were and continue to be for the millions of Americans living as I once lived. In juxtaposition, I'll refrain from listing the other reasons why I made it out while others haven't. But as you'll hear from the other panelists today, it had absolutely nothing to do with hard work on my part. So I'm going to use my time this morning to try and provide a narrative which might highlight the data and research presented by the other panelists to follow me. So while I was young, we received WIC benefits and assistance from church food pantries. The only two instances in which my parents ever applied for SNAP benefits coincided with the 2 times we were evicted. Once when I was a toddler and once again on the day I left for college, a feat that was only possible thanks to a full ride scholarship for which only low income first generation students were eligible. So during this like 16-year gap between the 2 times we were on SNAP benefits, I witnessed the profound effect that competing fixed costs had on the food we consumed at home. If you've ever been low income, you know that it teaches you to be thrifty is the nice word. Growing up, our diet was a lot of the processed foods you might expect, you know, ramen, mac and cheese, etc. If you could buy it for under $1, we pretty much eat it. Largely, this was because it could be bought at one of the corner stores within walking distance of our home. And this was important because we only had 1 car to a family of 5. My dad was an excellent cook and could make large batches of food from very few ingredients. But usually protein would be supplemented with potatoes. It wasn't until I went to college that I found out that not everyone has a potato cabinet. If the lights or the heat were turned off, as they were usually about every other month, my parents would prioritize purchasing a tank of propane for this cheap outdoor grill that they had purchased at a garage sale for like $10. And the grill could be used to cook frozen pizzas, hot dogs, boil water for pasta. Sorry, there's a plane coming over. But it could also be used to boil water for bathing and washing clothes, which it frequently was. I recall, I think I was, 10 or 11, and my Mother's Day present to my mom was to boil pot after pot of water and carry it into the bathroom and pour it into the bath so that she could take a hot bath. I still knew how to read the tags at the store to determine the price per ounce before most kids. But we'd still buy the smallest thing of peanut butter or jelly or pasta or whatever because it was cheaper at checkout than the larger, more economic jars that were more expensive in the immediate moment. I got my first job when I was 14 at a local ice cream store that was within walking distance of both my home and my high school. Again, vital because we did not have a car. My paychecks almost immediately went to helping meet ends at home. For a period of several months during my senior year of high school, it was the only income we had. I vividly remember getting off work at 11 p.m. and going to Walmart to buy food for the family. And having just been paid, I had a total of $600 that had to be divided amongst, I want to say it was like $2,500 worth of household bills, and still have enough money to buy food for the family and buy gas to drive myself to college the next week. So while attending college full-time at this small liberal arts college in rural Nebraska, I was also working 3 jobs to support myself and my family back home, who, because they had been evicted and hadn't quite recovered, were living in a friend's trailer in the middle of nowhere with no heat. I made friends, but they didn't quite understand having to weigh the pros and cons of skipping class to get a few extra hours on the clock at work, which was a coping mechanism I had developed clear back in high school and had ended me up in detention, in-school suspension for a number of times because the school didn't quite recognize that, to me and my family, the more important part was the extra over a week. I would skip the last period of class and, I could make an extra $50 at work because if I skipped that class. And to me and my family, that $50 was much more important than my, it was my English class or something like that. But I had friends who didn't quite understand that kind of those pros and cons. And, in the cafeteria, I'd see them throw away half-eating plates of pasta, pizza, salad, you name it. And I just got a lump in my throat thinking of my family and what they were going through back home, but also the times that we had managed to make ramen stretch for a week until payday. But this was just during the few times I was able to actually make it to the cafeteria for meals because my work schedule often overlapped. In replacement, I just skip meals or fill up on water, which are coping strategies that I had not only had followed me from my childhood, but they're also strategies I learned that I shared with other food insecure college students. During my master's at Kansas State University, my thesis focused on food insecurity among college students, and the narratives they shared were harrowing, that they'd chew gum to stave off hunger pangs, that they would invest in weight loss tea because it subdues the hormone ghrelin, I believe it is, that causes the pangs of hunger, just to be able to get through the day. I remember sitting in my intro level political science class and listening to my professor explain SNAP, WIC, TANF, and then try to spark a discussion with the class about the role of government in the lives of the poor and the hungry. And I sat in the back of the classroom and kept my mouth shut, terrified that correcting my classmates, despite whatever inaccuracies they would say, would label me as one of those people that they talked about. Those people who hadn't worked hard enough, who had made poor choices despite making the best choice of the very numerous poor choices that they had been presented. Someone who was just too ignorant to figure out how to live life like everyone else. Today, on the other hand, I'm just as concerned about staying quiet, but this time I insist my voice is used on behalf of the millions of people who are still stuck in positions like that. I understand that testimony will be offered today by several content matter experts. I'm so honored to be sitting among you, and it may be overwhelming to members of this committee to hear how many variables can intervene with achieving food security. And I challenge you to take that perspective and put yourself in the shoes of someone who, like my family, was only able to see literally a few hours in front of them because the gauntlet of trying to make ends meet was just so dense. So before I yield my time, I want to emphasize the difference between two key terms that I think might get thrown around a lot during this and really any subsequent panel that this committee holds. And those two terms are hunger and food insecurity. So hunger is a biological response. It's designed to tell a person's body that they haven't eaten enough food, or more importantly, enough of the right food. Food insecurity, on the other hand, means that a person is uncertain how, where, or when they will access their next meal. Food insecurity is a negative consequence that stems from a system that just isn't working how it should. Food insecurity, therefore, leads to hunger. And I offer this because when we talk about addressing hunger, we often end up with temporary fixes. Necessary, believe me, everyone needs to eat in that moment, but they're still temporary. They're Band-Aid approaches. But when we start talking about addressing food insecurity, that's when we get to start talking about root causes. And that's when we get to start talking about solutions. And on a personal level, that's why my career centers around food insecurity. Not only because it's something with which I have intimate experience, but because it's an affront to personal dignity. It's a massive and often impossible hurdle to overcome on the way to individual, community, economic success. And most importantly, it's a problem that can be solved. The biggest mistake I think that we as advocates, as members of this community, can make is assuming that food insecurity will always be with us, and that it's something that can only be mitigated or minimized rather than solved. And with that, I will yield my time.
Thank you very much. Appreciate your testimony. Ms. Sadian?
Yes, thank you, Chairman, Ranking Member, and members of the committee. I'm grateful for the opportunity to be with you today. The connection between food insecurity and affordable housing is clear. Housing costs are typically the largest expense that a low-income household will face each month. But because of the growing affordable housing crisis, millions are struggling to pay rent, put healthy food on the table, and meet other basic needs. In order to end food insecurity, Congress must also end homelessness and housing poverty. The underlying cause of the housing crisis is the severe shortage of homes affordable and available to those with the lowest incomes. For every 10 extremely low-income households, there are fewer than 4 homes affordable and available to them. And there is not a single congressional district or state with enough affordable homes to meet this demand. Without affordable options, 8 million of the lowest income households pay at least half of their income on rent. And despite the clear need, only 1 in 4 households who are eligible for housing assistance receives it because of chronic underfunding by Congress. Households who pay more than half of their income on rent spend 74% less on healthcare and 35% less on food than other low-income households. And these families have no choice but to forego healthy options, delay healthcare or medications to pay the rent. These households are also at heightened risk of facing eviction and, in worst cases, homelessness. The racial disparities in housing and other sectors lead to inequitable outcomes. Black, Indigenous, and Latino households are disproportionately likely to be renters, to have extremely low incomes, to struggle to afford rent, and to experience homelessness, and they are much more likely to face food insecurity. The National Low-Income Housing Coalition, together with our national partners, launched the Opportunity Starts at Home campaign precisely because of the cross-sector impacts of the housing crisis. Opportunity Starts at Home is a long-term, multi-sector campaign designed to address the rental housing needs of the nation's low-income people. And the campaign was launched because we understood just how central housing affordability is to other national priorities, including food security, healthcare, education, and more. The campaign advocates for long-term solutions, including those that bridge the gap between wages and rising housing costs, to preserve and expand the number of homes affordable to people with the lowest incomes, and to provide emergency aid to sustain people during financial shocks. Congress can advance this agenda in the Build Back Better Act, which currently includes the campaign's top priorities: $90 billion to extend rental assistance to 1 million more households, $80 billion to preserve public housing for more than 2 million residents, and $37 billion through the National Housing Trust Fund to build 330,000 homes for people with the greatest needs. Together, these investments would end homelessness in America, preserve public housing, and pave a path to universal housing assistance, but they would also have wide-ranging impacts beyond housing. It would help increase food security, allow for better health and education outcomes, and lead to safer, stronger communities. They must be included in any final package. Housing and food security are closely linked, and ending homelessness and housing poverty is necessary in order to effectively end food insecurity. I want to thank you again for the ability to participate today, and I look forward to your questions.
Thank you very much. Mr. Barber.
Thank you, Mr. Chairman, and to everyone, all the panelists participating today. My name is William J. Barber III. I am a resident of Durham, North Carolina, and founder and CEO of the Rural Beacon Initiative, a small consultation firm that works to advocate for climate and environmental justice by promoting community-based clean energy projects. I'm also the co-chair of the North Carolina Poor People's Campaign Ecological Justice Committee, a group that seeks to educate and elevate the plight of poor communities to the front of our social discourse and policy solutions. I have a BS in environmental physics and received my law degree from UNC School of Law in Chapel Hill. I am tasked today to give an overview of the impacts that energy burden has on poor and low-income communities and how it exacerbates food insecurity. Energy burden is defined as the percentage of gross household income spent on energy costs. According to Department of Energy's Low-Income Energy Affordability Data tool, the national average energy burden for low-income households is 8.6%, 3 times higher than for non-low-income households, which is estimated at 3%. In some areas, depending on location and income, energy burden can be as high as 30%. Of all U.S. households, 44%, or about 50 million people, are defined as low income. Those living in energy poverty who choose to prioritize warmth are often forced to make difficult decisions about household essentials, which can lead to poor diets, known as a dilemma called the heat or eat dilemma. In a 2020 publication entitled High Energy Burden and Low-Income Energy Affordability, Marilyn Brown et al. Found that, and I quote, despite decades of weatherization and bill payment programs, low-income households still spend a higher percent of their income on electricity and gas bills than any other income group. Their energy burden is not declining, and it remains persistently high in particular geographies such as the South, rural America, and minority communities. In a 2021 publication on energy impoverishment and energy insecurity in the United States by Dr. Elva Moleka, it was found that alarmingly, despite energy abundance in the US, coupled with the propagation of energy efficiency, bill payment assistance programs, and weatherization programs, low-income households continue to pay high energy bills whilst their environmental, social, and economic conditions erode. Equitable energy distribution has long been an issue of concern when studying the prevalence of high energy burdens, and there is far greater eligibility and need to participate in existing bill payments assistance and weatherization programs than there is availability. Rather, many low-income households continue to live in older homes, which are often characterized by structural issues such as poor insulation, inefficient HVAC systems, leaky roofs, and inefficient and sometimes oversized appliances that increase energy costs. Additionally, many low-income households struggle to pay their utility bills due to the unprecedented economic, social, and health challenges of the COVID-19 pandemic that dramatically impacted the ability of households to meet their financial needs. As a resident of North Carolina, I come from a state where 1.4 million people are sent energy bills every month they can't afford. Structural issues with the houses and apartments accessible to poor people often make it difficult to incorporate solutions such as solar arrays or energy efficiency measures, both of which also have high upfront costs. Racial disparities exacerbate this energy poverty. Energy burdened households are more likely to earn less than $20,000 annually and be of African American or Latino descent. Compared to white households, Black households spend 43% more of their income on energy costs, Hispanic households spend 20% more, and Native American households spend 45% more. Legacies of discriminatory policies like redlining have made households of color more likely to live in inefficient housing with old, energy-guzzling appliances and HVAC systems. The reality is exacerbated by the fact that the same families plagued by these high energy costs are the same families locked into a cycle of poverty where they are forced to choose between what are they able to eat and household utility bills. According to a recent report by the American Council for an Energy Efficiency Economy, 25% of Americans pay more than 6% of their income on energy bills before COVID-19 hit. Of those people, 13% pay more than 10% of their income on their energy bills. Nationally, 67% of low-income households face a high energy burden, and of those households, 60% have severe energy burdens. The report found that the energy burden in 4 southern states, Alabama, Kentucky, Mississippi, and Tennessee, are the highest in the nation, 38% above any other region, with Alabama being the worst in the country. The vicious cycle of poverty might best be described as what Dr. Sakobi Wilson of the University of Maryland School of Public Health describes as environmental slavery, where the environment that you are in keeps you locked in poverty and suffering. There are many factors that might influence high energy burden. Examples include higher cost fuels, such as propane or other bottled fuels, and inefficient homes. There are factors that can prevent low-income households from accessing energy technologies, including a lack of qualifying credit and the inability to finance upgrades. Lead Tool data estimates that 59% of low-income households are renters, not owners of their homes. This predominance of renter further compounds the issue into a split incentive. Landlords may not be motivated to pay for energy improvements, leaving potential energy bill savings out of reach for low-income tenants. There is hope, however, if our leaders act. Funding weatherization and energy efficiency programs, such as the installation of smart equipment, could have the greatest impact in high energy burden states. The introduction of energy efficiency programs in each state could lead to up to $600 or more cost savings per household per year, or approximately 25% reduction in energy burden. Electric bill savings delivered by Solar for All programs are other solutions to the energy burden problem, in that this method could provide LMI families with the benefits of locally generated clean energy through efforts such as the DC Solar for All project. In addition to energy efficiency, investments in utility bill assistance programs such as the Low Income Home Energy Assistance Program and Weatherization Assistance Program can help save low-income families hundreds of dollars per year, allowing more disposable income and allowing more opportunity to address hunger and food insecurity. That I yield my time, and I thank you for the ability to comment.
Thank you very much. Dr. Michner.
Right. Get so caught up in listening to everyone else's wonderful comments that I forgot I was next. But Chairman McGovern, distinguished members of the Rules Committee, and honestly, everyone participating today, thank you for gathering and for holding this space to discuss the critical issue of food insecurity. I, of course, appreciate the opportunity to speak. And what I'll be doing is drawing on my research expertise to highlight the experiences and voices of Americans who are living in or near poverty, shouldering sometimes devastating health cost burdens, and struggling to feed their families. So my name is Jamila Michner. I'm a social scientist whose research focuses on poverty, racial inequality, and public policy. I spend much of my time studying and teaching about the ways that public policies interact with the larger economy to shape and often to constrain the civic and material well-being of low-income families. Much of my work is focused specifically on health policy. My research speaks to the circumstances of Americans living in or near poverty, who are disproportionately people of color, and who have to navigate the US healthcare system in the context of economic instability and insecurity. As co-director of Cornell's Center for Health Equity, not only do I conduct my own research, but I also support other scholars in conducting research on health policy, health systems, and the social determinants of health. A central takeaway I want to emphasize today is that health is an expensive resource in the United States. It should not be, but it is. Healthcare is contingent on economic status and exceedingly difficult for many people to afford, even people who have health insurance. This means that maintaining your health and the health of your family can create budgetary burdens and siphon resources that would otherwise be used for crucial needs like food and nutrition. So, as we consider pathways to ending hunger, we must confront the related challenge of providing people with affordable access to high quality healthcare. Now, to ground our understanding of these issues, a few, I think, facts are helpful and illuminating. These facts point to a key point, which is that low-income families are made more financially precarious when they pursue their healthcare needs. Consider the following. A little over 1/4 of US adults, roughly 26%, say that they or a household member have had problems paying medical bills in the last year. And about half of this group, so about 12%, say medical bills had a major impact on their family. In 2020, about 18% of US households reported having medical debt. When we look at patient out-of-pocket healthcare costs, they're up 10% in the last year alone, with the net patient financial responsibility amounting to about $491 billion. That is how much the American people are shouldering to pay for the costs of healthcare. In 1980, the average annual patient financial responsibility was about $250 per patient, and it has continued to increase over time, such that now it's about $1,650. If you live in a low-income family, that is a debilitating cost. Medical debts are higher in poorer neighborhoods. In the lowest income zip codes, people owe, this isn't what they've paid, this is just what they've been unable to pay and still owe, about $677 on average. That's in the lowest income zip codes. And of course, people who report problems with paying their medical bills commonly also report that as a result of these bills, they're spending less on other household necessities. A 2018 survey out of the University of Chicago found that 30% of people surveyed struggle to pay for necessities like food, heat, and housing due to medical costs. These struggles are worse for people who have chronic illnesses, So about 1 in every 3 chronically ill people report being unable to afford food, medications, or both. And in a study focused on heart disease, more than 1/3 of people with medical bill problems said they skipped needed drugs and cut back on groceries because of financial distress. So we have these basic facts and honestly a growing body of evidence in the research community that links food insecurity to health. And this relationship is reciprocal. Not only can being insecure in relation to access to food and nutrition cause health problems, right? But it goes the other way around. People who have health problems are more likely to have challenges around medical debt and costs. So these relationships are reciprocal, they build on one another, and they contribute to a devastating cycle by which food insecurity and financial burdens related to medical care set off mutually reinforcing patterns of precarity that leave many Americans, too many, sick and hungry. Now, before I wrap up, I really want to make sure that we don't just consider the numbers, but that we consider the experiences of people every day on the ground. While the numbers can seem abstract and far away, I always think it's important to concretize them with the reality that people face in their lives. And part of what I do as a scholar is multi-method research. So a lot of the work that I do focuses on quantitative, statistical patterns, but I also talk to people systematically, do qualitative research to find out what's happening in their lives and why. So I'll give you one example of someone I met in the course of doing this who can really bring these issues to the fore for us. Margie is a woman I met in Illinois. She was 61 years old at the time we spoke. She was unemployed, but actively looking for work. She was also a diabetic with very high healthcare costs. Unfortunately, she was too young to qualify for Medicare, but she wasn't enrolled in Medicaid, though she was likely eligible. She hadn't enrolled. Margie needed both food and medicine to live, but sometimes she found herself in an impossible position of having to prioritize one over the other. This is how she explained it to me. Go to the grocery store, then you can't go to the doctor. And I have to go to the doctor every 3 months. I have to have pills every damn day. So this is very expensive. You know, sometimes you have to choose between medicine and food, and that's rough. That's directly from Margie. To navigate this complex dance, balancing a slim budget to meet both her health and nutrition needs, Margie utilized every resource she could. For example, she explains to me that she relied heavily on community health clinics in her neighborhood. Here's what she said about it. I get a discount when I go to the Board of Health clinic. That's all I got to depend on is those clinics, because I only pay $15 to see a doctor. I go there to see a doctor, he prescribes the same medicines. I have 3 or 4 medications I take a day. But they're talking about closing the clinic down now. I'm afraid. I'm afraid that when they do, if this goes any further, then I'm going to be broke and I can't still afford to pay my insurance or my bills. Now, Margie is just one example of a larger pattern, and I've talked to many people like this. Many Americans have limited budgets that are stretched unbearably thin by mounting medical costs. They rely on a patchwork of federal, state, and local programs to survive. When those policies lack sufficient resources, economically vulnerable Americans are unable to make ends meet, and they face choices between core necessities like food and medicine. This is not the way it has to be. This is a choice. Though many of us have become accustomed to stories like Margie's, most Americans don't believe anyone should have to make these trade-offs. 63% of Americans believe that the government has a responsibility to ensure that everyone has affordable health care. Government can play a vital role in securing widespread protections from the debilitating financial consequences of the US healthcare system. Some programs that are already in place are shields from the economic disaster that exacerbates food insecurity. Medicaid, which I spend a lot of time studying and thinking about, is our nation's largest health insurance program. It provides coverage to low-income families. Medicaid serves nearly 80 million Americans. Research shows that it protects people from medical debt, from bankruptcy, from eviction, and from a range of financial catastrophes by providing them with much needed access to health care. Supporting and strengthening Medicaid can help the very families most likely to face food insecurity. This means expanding Medicaid in states that have not done so and strengthening the program everywhere. Changes made during the pandemic have taught us about what works to keep as many people insured through Medicaid as possible. Policies that allow for continuous eligibility so that the risk of being disenrolled is removed, easy and accessible application and renewal processes, and reduced administrative burdens are all an important part of making sure everyone who needs Medicaid can get it. Another key goal worth considering is to improve coordination between public benefits programs focused on health, like Medicaid, and those focused on nutrition, like WIC and SNAP. Research shows that both WIC and Medicaid participation are associated with less food insecurity and fewer cost-related medical burdens. Still, programs like these often operate in silos, despite serving largely overlapping populations. Coordination, communication, and learning between programs can help to make existing policies more effective while providing resources to people who need them in the most humane way possible. Making sure that the people administering these programs understand the resources available to program participants and are trained to identify problems like food insecurity can direct program participants towards more resources and crucial solutions. Even beyond public programs like Medicaid and Medicare, there are numerous options for alleviating the challenges that emerge at the nexus of food insecurity and medical scarcity. The range of possibilities include robust and continual funding for local health institutions like community health clinics, especially those in low-income communities and communities of color, regulations that limit the incidence of surprise billing, and programs that provide relief from medical debt. In many ways, the policy options that I've offered only scratch the surface. The other people who have spoken today have talked about other options that are also vital. The policy options are plentiful, and the imperative is clear. Food and medicine are both fundamental human rights. In a country with the resources and wherewithal of the United States, we can provide both of these vital resources to every denizen, especially those who are most vulnerable. And I yield my time. Thank you.
Thank you very much. Mr. Mackinnon.
Mr. Chairman, members of the committee, in Kansas City, we look at public transit a totally different way. It's about access. It's about access to jobs, access to education, access to healthcare, and access to housing. And everybody I'm hearing right now, isn't that the point? Isn't that the common denominator about access, whether it's access out of food deserts, access to better employment options, access to better health care, all of that. So that's what we concentrate on. Those are our 4 pillars of public transit. But that's on a foundation of social equity, all right, which we are now doing zero fare, and that's what we consider social equity. Not charging a fare on public transit, giving people access. Talent has no zip code, opportunity does. It's our job to help people get to those opportunities. And if you can get to healthcare, get to your doctor's appointment, get to this store, how can you talk about housing without public transit? Public transit is infrastructure, just like a curb or a sewer or anything else. Giving folks access, it makes all the difference in the world, right? So you talk about zero fare. We've been doing zero fare for about a year and a half here in Kansas City. And thanks to Emmanuel Cleaver, Congressman Cleaver, we started down that road about 3-4 years ago with making public transit free for our veterans, right? Then we went to school kids, then safety net providers, and now the region as a whole. So it's not like we just flipped a switch. So what does that actually mean? What it means is we do 40,000 trips a day, and that $1.50 that we charged, where's that $1.50 go if it doesn't go into my fare box? Okay, it goes right back into the local economy. It's not going to South Dakota or the Caymans. It's going right back in the local economy. It's going to pay for a pair of shoes, some groceries, help with a prescription, that kind of thing. You're talking about $1,500, $2,000 a year per person that can actually be used rather than going into my fare box, which then what? gets us a couple more seats at a chamber dinner, or, you know, buy some more bottled water or whatever that is. Let's take this taxpayer money and actually put it where it's supposed to go, right? Which is a beautiful thing. So I would argue that, you know, doing 13 million trips a year here in Kansas City, that that we're actually, you know, pumping $1.52 million right back in the local economy every month by it not going into our fare box. And the difference that makes for the folks that actually need it the most, to me, charging people a fare on public transit is like it's another regressive tax, okay, on the people that need it the most. By allowing people access to anywhere in the region, by allowing them to take that money and put it somewhere else, but still have the opportunities, it's been absolutely fantastic. And I think it connects. Public transit is that great equalizer. Everything everybody's talking about today, public transit connects to that. Okay, you know, just like I said, housing, education, all of it. Okay, so by allowing people access, by allowing them to do it for zero fare, it's worked great for us. Okay, what everybody wants to tell me is, well, safety issues, right? Oh, you can't do that. Society will break down. Cats living with dogs, the whole deal. That didn't happen. Actually, incident rates went down further because 80% of any incident we ever had on a vehicle was over a fare box dispute. Okay, and during the pandemic, when everybody else's ridership went down to 20%, ours barely dipped below 60. Why? Because people had access. You didn't have to pay to get on the bus. You could get to work. Our essential workers that help keep this city breathing and this country breathing were allowed to get to work and save a couple of bucks in the process. Okay, so anytime we talk about any of these issues, Mr. Chairman, I would urge that we talk about public transit in the same vein, because it's that important, allowing people that access. Ridership, everybody wants to talk about ridership. Ridership's a byproduct. Ridership's a byproduct of do you have access and options around your region. The return on investment, Mr. Chairman, the return on investment for empathy, for compassion, for social equity far outweighs the return on investment for asphalt and rubber and aluminum. We want to invest in people, and that's what you're doing. By going zero fare, you're investing in people. Okay, we have numerous reports from universities around here that talk about that $1.50 will turn over 3 or 4 times and generate $17 million of economic activity instead of it going into our fare box. It's just, what do you want to invest in? It's about public transit being a part of the solution. It's about public transit agencies not sitting out on an island and just worrying about their own. It's weaving yourself into the community fabric and caring what happens outside the curbs, not just inside the curbs. What we've also done, sir, is worked with Truman Medical Center, University Health here, with CEO Charlie Shields, and we do a mobile market. We've taken our bus, one of our 40-foot buses, turned it into a market, use local food, and drive around to different parts in the city so people can come on, get some food locally grown, pay a minimal price for it, and then, you know, get off. It's a beautiful scenario of how public transit can be a part of the solution, how public transit is important, but it's never talked about. So again, sir, thanks for the time, and I'll answer any questions anybody has.
Many thanks. And finally, Mr. Johnson.
Mr. Chairman, members of the committee, thank you for this opportunity to be with you. Greetings from the poorest state in America. At the MacArthur Justice Center here at the University of Mississippi, we have for years used litigation as a vehicle for challenging a criminal justice system that pummels the poor and creates substantial barriers to economic stability for millions of people annually. And through court observation and litigation of debtors' prison cases, we have seen firsthand the devastating impact of excessive misdemeanor fines and fees, and the judicially sanctioned shakedown of people threatened with incarceration, license suspension, wage garnishment, credit score damage, loss of voting rights, tax refund intercepts, and loss of professional licenses if they don't pay up. These people, disproportionately people of color, because of over-policing in certain communities, are forced to make very difficult choices, and many ultimately choose to go without food. The scope of the problem is sobering. More than $50 billion in criminal debt is owed by approximately 10 million people in the United States due to their involvement in the criminal justice system. In Mississippi alone, people involved in the criminal justice system owe more than $507 million in this, the poorest state in America. It's estimated that approximately 13 million misdemeanor charges are brought every year, and that doesn't include more than 40 million speeding tickets issued every year. In nearly 600 municipalities, cities and counties use fines and fees to account for over 10% of their general revenues. In 80 of those jurisdictions, fines generate over half of budget revenues. It's important to understand what these proceedings look like. For those appearing in misdemeanor courts and traffic courts across America, justice is swift and harsh. With very few exceptions, defendants do not have lawyers. Dozens or hundreds of cases are handled in a single court session, and the amount of time spent on each individual case can often be measured more in seconds than in minutes. Fines are meted out without regard to economic realities, people's ability to pay. One size fits all. Someone living at the poverty level pays the same fine as a neurosurgeon. And state assessments, add-ons, not discretionary, taxes passed along to those involved in the system often amount to more than the fine for the underlying conduct at issue. In a matter of minutes, misdemeanor defendants can find themselves owing thousands of dollars. Payment terms vary from jurisdiction to jurisdiction. It's not uncommon for people to be given only 90 days, in some instances less, to pay $1,000 or more. And as we've heard here today, that ignores the economic reality of too many people in Mississippi and across the United States. The Federal Reserve's recent report on the economic well-being of U.S. households finds that 40% of Americans would not be able to pull together $400 in cash without borrowing money or selling possessions, highlighting the impact that fines and fees have on financial security. A survey by the Alabama Appleseed Center for Law and Justice found that those with court debt, more than 80% cut back on basic needs like rent, food, healthcare, car payments, child support. Almost 40% committed a crime to pay off their debt. 44% used payday or title loans to pay off that debt. And almost 50% shared that they just don't think they'll ever be able to make those payments. Our friends at the Fines and Fees Justice Center have been doing an excellent job of collecting information about the suspension of driver's licenses for non-payment. In 34 states in the United States, you can still have your driver's license suspended because you aren't able to pay these fines and fees. And what we know in Mississippi is that not many of us have access to public transportation here, as is true for so many people across the country. The reality is that if you're going to the grocery store or to work or to take your children to school or to the doctor or to church, you're going to have to drive a car. So for those people, for those millions of people whose driver's licenses are suspended, you add on additional ticket after additional ticket for driving without a license and often for not having insurance. And in Mississippi, that's $750 a pop. And so thousands in additional fines and fees result from this practice of suspending driver's licenses. I do want to talk briefly about reentry, and I know my time is limited. Each year, more than 600,000 people leave prisons in the federal and state systems and return to our communities and our neighborhoods. 91% of returning citizens report being food insecure. As I understand our social contract, the deal is If you pay your debt to society, then we welcome you back into the community and we provide a vehicle for you to be successful and stable. But the reality is that very few states, if any, have implemented the kind of robust systems necessary to help those returning to our communities, having paid that debt to society, help them be secure and successful. And far too many are unable to obtain employment, housing, transportation, healthcare, and any version of economic security. I can never talk about criminal justice and poverty without talking about the indigent legal defense system. It is troubling the extent to which we fund police and prosecutors and we ignore the financial realities of public defender offices across the country. Early intervention by competent defense counsel makes a difference in outcomes in all types of cases, not just murder cases, not just felony RICO cases, but in traffic tickets and in misdemeanor cases. And these outcomes matter to people. We see that today. If we believe in the promise of Gideon, we need for Congress to provide support, economic support, and grants to local communities so they can fund robust and meaningful indigent legal defense systems. In my written remarks, I made a number of policy suggestions. I won't go into those now, but I welcome questions. I would just say that as we focus on family budgets today, I do think it's vitally important that we understand how fines and fees in particular are real budget busters. Unlike other debt collectors where they threaten you with referral to a collection agency, misdemeanor judges threaten incarceration, driver's license suspension, loss of voting rights, and the other parade of horribles I shared with you. For the millions of people caught up in this system, doing without basic necessities like food is often seen as the only way out. I yield my time and welcome questions.
Well, thank you very much. And I'm going to yield to my colleagues before I ask questions, but and how they got onto the hearing, Ms. Ross, Mr. DeSagne, Ms. Scanlon. But before I do, let me just say to everybody, thank you very much for your testimony. And I think you all kind of help reinforce a point that we're all trying to make on the Rules Committee, and that is to solve this problem. It's not one program or one thing. It's a whole bunch of things. And we have been meeting, just so you know, with the president's cabinet, kind of one by one, getting to know them, but also to ask them to buy into this idea of a White House Conference on Food, Nutrition, Health, and Hunger. You know, and Mr. Mackinnon, you'll be happy to know we met with Secretary Buttigieg, and we talked about the role that transportation plays on this issue. People, access is a big deal. Affordability of public transportation is a big deal, and that he has a role to play in this. And so when we talk about a White House conference, we're not talking about simply a USDA-led conference. Yeah, SNAP is important. That's a big part of this, but it's not just that. It's transportation. Ms. Sedin, we talked to Marcia Fudge already at HUD and talked about the connection between housing and food insecurity and hunger. And she's on board. Mr. Barber, we had a meeting with Secretary of Energy Jennifer Granholm, and we asked her, would you get on board? She says, well, I'm the Secretary of Energy. And I'm like, yeah, you are. And you have a big role here. I mean, climate change is it impacts our food supply, but utility costs, I mean, I'm in Massachusetts right now. We have cold winters, and people have to pay for their heat. And that comes out of their food budget. And I was out in Arizona a couple of months ago, and it's hot in there. I think some parts of California it's hot, although I'm told it's a dry heat, whatever that means. I have no idea. But in any event, they have utility bills that are, that are related to cooling, and so everybody has a role to play. So we want this White House conference where it's an all hands on deck approach. And people ask me, like, why is the Rules Committee doing these hearings? The reason why is because the jurisdiction for all the things you just talked about fall under like 1,000 different committees. And we don't work like collaboratively as we should on some of these issues. And so in the Rules Committee, we have no jurisdiction. No jurisdictional constraints, I'm sorry, I mean to say. So we can do whatever the hell we want to do. And so what we're trying to do here is kind of act a little bit like the old select committee on nutrition and human needs did, and look at this more holistically. And so that's the goal here. And what I hope happens, after this hearing is over with today, in addition to your comments being part of the record, but we want the administration to say yes to this and then reach out to all of you, and to say, okay, well, here's our, this is the focus on transportation, and this is the focus on utility costs, and this is the focus, on housing and on, criminal justice reform. And and that you will help lay the groundwork for what would happen in a conference. And again, we want to have a conference that's not a press conference. We've been to enough press conferences. I mean, we want results. We want benchmarks. We want solutions. There are things the administration could do. There are things that Congress has to do. And then the final thing I'm going to say before I yield to Ms. Ross is that we're using these hearings and these discussions to raise awareness, because I want to tell you, people don't always connect the dots. And a lot of people, including members of Congress, have no idea about some of the things you just talked about. I hate to say, don't tell anybody I'm saying this, but intelligence is not always a prerequisite for serving in Congress. So just, and so sometimes we have to be educated, and you have to help lay out the issues, so that when people are talking about, how we deal with food insecurity and hunger, it's not just we need to do better with SNAP. Yeah, we need to do better with SNAP. It's not the only thing. And also to highlight the complexity of life. I'm sick and tired of people telling me, well, you can solve the hunger issue in this country and the food insecurity issue if people just got a job. Got to want to work. One of the things we point out to people is the majority of people right now who are able to work, who are on SNAP, actually do work. So, clearly, the people who say those things don't understand the reality. And so that's what this is all about. So this is a very good panel, because it reinforces the complexity of this issue. This is not simple, right? It's complex. And in order to get it right, it's an all hands on deck approach. So let me, with that, yield to Ms. Ross first, and then Mr. DeSanya and Ms. Scanlon, and then I'll be the final questioner here. So Ms. Ross.
Well, thank you, Mr. Chairman. And as a representative from North Carolina, I want to thank William Barber for being with us. I know your dad extremely well, and I think I've met you once or twice. But I want to especially welcome you to the Rules Committee. Please come in person sometime. We have a really cool meeting room. And I have to jump off in just a couple minutes for another meeting, but I'd like to just pose this one question, and then hopefully there can be a discussion for the record. But we've heard about different approaches to dealing with poverty issues. We've heard about different states. North Carolina has an expanded Medicaid, so I really appreciated Dr. Michner's comments about that. We're working on getting some more help for that in Build Back Better. We got some in the American Rescue Plan, but let's just say nobody took the extra incentives that we gave. I would like each of you, and maybe starting with William Barber, because he talked some about rural projects, to talk about the scope of the problem as it differs between rural and urban communities. Because obviously transportation is a different issue in rural communities, even though I totally believe we should have fare free transit. You don't even get that much revenue from the fares. I mean, forget it. we should just do that. But there are certain challenges that urban folks have with both poverty and hunger, and different challenges that rural folks have. And I'm going to have to read the transcript to get the answer, but I'd like to just open up this question and have people address it. And then, Mr. Chairman, you can move on to somebody else because I need to go to my 3 o'clock.
Terrific. Okay.
Okay.
Well, Mr. Chairman, I'll start if you'll let me.
You can go. We'll go. All right, Mr. All right, Mackinnon.
Sir, what I will say is the Congresswoman's absolutely right when it comes to transportation, whether it's rural or urban. But what we have to do as a country, what we have to do in our regions, we got to stop pitting one against the other. What we have a tendency to do is it's streetcar versus bus, bus versus Uber, Uber versus scooters, microtransit, whatever that may be. There's room in the tent for everybody. What we like to say here in Kansas City is that we're mode agnostic, right? All of these things can help connect. So us being able to have relationships with companies like Oates that can go out and work with us and collaborate with us to handle rural transportation issues, but then still have that connect back to main arterials and that kind of thing has worked very well in the state of Missouri.
So I'm just going to call on people because as you look at my screen here, Mr. Barber, do you have anything to add to that?
Absolutely. I would say that, Representative Ross is right when you talk about a unique challenge, especially in the context of energy burden in rural versus urban areas. One piece is that, rural communities have higher concentrations of low-income households that experience high energy burden and often can't afford those upfront capital costs for energy efficiency improvements that we talked about. Often in rural areas, studies have shown that renters make up a more significant proportion of the individuals in rural households. So there are also limitations for what improvements can be made in a rental context versus a landlord context. Rural communities and households are often serviced by rural electric cooperatives, many of whom rely on propane and fuel oil for heating. These providers don't typically fund weatherization and efficiency programs. I do want to acknowledge that there have been some breakthroughs with leadership by groups like Roanoke Chowan Electric right here in North Carolina that has looked at inclusive financing for energy efficiency programs to kind of break through the financial barrier for rural communities. So that's something to think about, but also the limited broadband access in many rural communities that often impacts the ability to deploy smart tech and energy monitoring technologies in these households in a more modern solution. Those are often limited by limited rural broadband access as well. So it's definitely some unique challenges that rural communities face in terms of this addressing the energy burden piece, but they need to be prioritized and nonetheless considered.
Thank you, Ms. Sadian.
Yeah, I think it's a great question. There are certainly unique challenges to affordable housing in rural areas that are unique to rural areas. But what we found through our research is that the same trends hold true in both rural, urban, and suburban communities, which is that the greatest need for affordable housing and the greatest shortage is for people with the very lowest incomes. And that even in rural places where housing costs might be less, you might think, okay, in a rural area, housing is more affordable because it's less expensive. Well, incomes are also less in rural areas. And so there's still this disparity between what people can afford and what their rent is. So for example, we have looked at every county in the US, looked at their prevailing minimum wage, and compared it to how much it costs to rent a 1-bedroom or 2-bedroom apartment at fair market rent. And what we found is that there are no counties in America where a full-time minimum wage worker can afford a 2-bedroom apartment, and only 5% of counties where the same worker could afford a 1-bedroom apartment. So that applies for rural and urban. Some of the challenges that are unique there, though, it is difficult to build affordable housing in rural areas. It can be hard to attract the capital that you need or compete for resources. They don't have the same economies of scale to spread out the cost of development. You know, you can imagine if you're building 100 units in an urban area, you can spread the cost out a lot easier than if you're building 25 units or 10 units. So there are certainly some unique challenges in our rural areas, but housing insecurity, homelessness are still very prevalent there, and the solutions are the same. We need to bridge the gap between wages and housing costs. We need to build more supply for those who have the lowest incomes.
Thank you very much. Ms. Miller Klugaser.
Yeah, thank you, Chairman. So I work across the state of Kansas. I live in a rural area, and we work with lots of rural councils across the state of Kansas. It's ironic because in the state of Kansas, though we're considered America's breadbasket, roughly 90% of the food that we grow isn't actually viable for human consumption. So we have a huge issue with food access and poverty, and the pandemic especially highlighted that. The two big things I would note when it comes to food access and food insecurity in rural communities is one, just supply chain disruptions and issues that were driven largely by the pandemic. You know, I mean, for example, I represent a council that covers roughly 30,000 square miles of northwestern Kansas, 9-county region that came together to work on a regional food systems because they don't have enough people in just one county. So they came together to work together as a whole. But a truck would come out and drop off food at a grocery store, and folks would rush to the grocery store and buy it out, and another truck would not come in for 2 weeks. And so you have people who are experiencing food insecurity for probably the first time. So that's one. The second instance, across rural America, we could talk about poverty all day long, but I think the first immediate question has to do with grocery store access. For example, we have a program in the state called the Rural Grocery Initiative that works, that looks specifically at the development and how grocery stores across the state are taking innovative approaches to staying open. I'll give you one example. The county of Crawford County, Kansas. The nearest grocery store to the town of Arma is 9.8 miles away. So it falls just under the federal delineation for a food desert, even though I don't like that term because it indicates that it's something that's natural instead of built. But if we're going to operate with that term, they do not receive federal funding because they fall under that delineation. So the grocery store in the town closed, and across the street popped up a Dollar General that doesn't always, you know, have healthy options. And not only that, but they also built it directly across a highway. And the population of Arma, Kansas is majority disabled, elderly, and high poverty individuals. And so there have been cases of folks having to walk across the highway and putting themselves in danger, even, you know, wheeling themselves across in their wheelchair because that's the only access they have to food in their area. We have instances of grocery stores across the state of Kansas who need to be talked into accepting SNAP benefits because they simply don't have the technology to accept SNAP, WIC, EBT, what have you. We have several instances of grocery stores being bought out by the city themselves and run as nonprofits, run as a community institution, run as a government institution, simply because it's so important. But that, I mean, those again are pale in comparison to the number of communities that, you know, their food goes away and then they have to, you know, drive to larger hubs that are 2-3 hours away just to get basic necessities, which I don't need to tell this panel is just not a viable option for many folks. So.
Thank you, Dr. Michner.
Yeah, I agree with a lot of the sentiment that's been expressed thus far as the kinds of challenges that we've been pointing out being challenges that exist across the urban-rural continuum. And certainly on the rural end of the continuum, there are specific and idiosyncratic problems that emerge, right? When it comes to sort of the financial debt or cost of medical care and medical debt more generally, we see similarly high rates of rural populations reporting medical cost burden as a problem. About a third, 32% of rural Americans surveyed in the 2019 study in the Journal of the American Medical Association, about a third say that they have trouble paying their medical bills and that they're struggling with medical costs. About 19% say, these are just rural Americans, say this is a major problem. So it's a major problem that's creating challenges with them fulfilling the other responsibilities that they have financially in life. And so it's certainly the case in rural areas that there's a real challenge with medical cost burden. There are additional challenges with access to care. And it's worth pointing out that some of the different areas we've been talking about discreetly thus far are connected. I've been doing some research focusing on the NEMT, the non-emergency medical transportation benefit offered by Medicaid. And one of the things that we've been trying to understand is what explains really dramatic variation in the use of the NEMT across place, not just states, but also the rural-urban divide. And what we know is that this is a benefit that Medicaid is intended to provide to ensure that this sort of problem around transportation doesn't become a barrier to people getting health care. And it turns out that many people are not using the benefit. And so they have the burden, the additional cost burden of paying to get to their medical provider. And so we've been trying to figure out why, what explains that, and how we can maximize even the existing resources so that people aren't using their personal resources to do things like get medical care. We've also been trying to understand the unique barriers around transportation to medical care and medical services that exist in rural areas. And so there are lots of interconnections here between the different areas that we've been talking about. And I think that this question of sort of place and whether you live in a rural or an urban context speaks to both the ubiquity of these problems that we've been talking about, that they really exist across that spectrum, but also the specificity of them, that we need to understand that although the problems exist across these spectrums, they manifest in different ways. And so we have to think creatively about solutions, and we have to be aware of sort of who's included and excluded as we develop policies, because we can develop some policies that are more well suited to rural communities, and that excludes urban communities, and vice versa, right? So we want to be aware of these specificities so that we design a full range of policies that really addresses the needs of the most inclusive group of people possible.
Mr. Johnson.
Thank you, Mr. Chairman. I think this distinction between urban and rural, first of all, urban is relative when you're talking about Mississippi, but this distinction taking into account differences in income, for example, in imposing fines, is exactly what we want, but we don't get. So fines look very similar urban to rural, despite the fact that incomes might be significantly different. State assessments, this kind of add on to every ticket written in Mississippi. I attached a fee schedule from a local community in Mississippi where you can see that in many instances, these assessments are much more than the actual ticket. When we sued the city of Jackson, we saw one ticket where the city of Jackson got $4 for failure to come to a complete stop at a four-way stop. The total amount of the ticket was in excess of $180, right? So we see this one-size-fits-all approach, which is problematic, and we urge an individualized determination of appropriate fees, appropriate fines, and we think this use of fees is problematic as a wholesale matter. We think states need to get out of the business of using the criminal justice system, and particularly the misdemeanor system, as another means of taxation. There are some distinctions I think are important. We urge providing community service opportunities to satisfy debts. Obviously, in rural communities, particularly in courts that have a more strict view of what satisfies community service, there are fewer options. There's a difference in courts. In rural communities in Mississippi, judges don't have to have any legal training at all. They don't have to have college training. They have to have a GED, and those people can be fine judges, but the lack of legal training does present problems when you're making legal arguments about equal protection clause matters and the Bearden v. Georgia case that says you can't lock up people because they're poor. And then also, of course, transportation. If we're going to talk about those many states and those millions of people who have suspended driver's licenses, for people in rural communities, you simply cannot function without driving a car. It's just, it ignores reality. And so one of the reasons we need to pass the Driving for Opportunity Act, Senator Wicker from here in Mississippi has been a strong proponent of that. Mississippi even has quit suspending licenses for unpaid fines. That needs to be a national initiative. It is because the practice we have now does ignore that reality. And then finally, of course, in rural communities, for those people, 600,000 plus people across the country are coming out of prisons, access to housing, jobs, employment, transitional housing, all those issues are much more difficult in rural communities. And many of these folks come out and they want to go back to the towns where they're from. And many of those are, in fact, small towns and rural communities. So there's a lack of access there as well.
Thank you very much. Mr. Desagne?
Thank you, Mr. Chairman. First, as a Californian, I just want to say it's because of the humidity that it's the dry heat in California. Having experienced humidity in Worcester and in Washington. And I just want to tell you, Jim, how inspiring this is. My emotions listening to this panel are depression, inspiring for all the work you do, all of you, and man, just angry, must tell you. Angry that, as some of you said, in the wealthiest country in the history of human existence, that we have this. Jim, your wonderful efforts around nutrition and hunger, but this panel in particular is so powerful. Stiglitz writes about this, about it's not just that wages have been stagnant for most Americans since the 60s and 70s, but the fixed costs, particularly for poor people, but for 90% of Americans, have gone up exponentially, as many of you have talked about. It's food costs, it's housing, it's transportation, it's education. Mr. Johnson, you remind me of a wonderful conversation I had with Elijah Cummings when he recommended that I read Slavery Under Any Other Name, a really profound book about just what you're speaking about. So what I don't really have a question, just a comment, Mr. Chairman. I had a town hall with my neighbor, Barbara Lee, our wonderful colleague, and the issues of rural and urban, I think, are important distinctions. But I'll tell you, living in the East Bay of the San Francisco Bay Area, one of the wealthiest places in the country and the planet, Congresswoman Lee and I spent a lot of time talking about the poverty in California. We have the highest rate of poverty in the country as a state when you take into, as the Obama administration appropriately did, the cost of living. 25% of Californians, and a lot of those people, younger people, who were lucky enough to get an education but struggled, as your testimony was, Miranda, was so inspiring, and that you've gotten through it. But the reality of this is frustrating in our discussion, Mr. Chairman. When we get called socialist, I was thinking as I was listening to this and watching you, how profoundly The Other America affected me when I was a young person, by Michael Harrington, a proud graduate of the college I graduated from. And that propelled Lyndon Johnson to do The Great Society. And here we are with colleagues calling us socialists because we want to help remedy this horrible, horrible inequality we have in this country right now. And the denial that the social contract is ripped apart for the last 50 years. So I want to tell you how profoundly this testimony affected me, and whatever we can do. The media right now is portraying us in the Democratic caucus as bickering amongst one another. Congressman Lee and I talked about this yesterday in our town hall. We're not bickering, we're fighting over what we think is important. And for those of us who are progressives, we think it's really important that we get everything we can out of these bills in front of us right now because of these issues you're talking about. We've left too many Americans behind for too long. So we listen to, and I really appreciate the nuances you're bringing up as well and the policy issues. But what I take from this is really how important it is that we are aggressive about telling this story in the next few weeks. That we shouldn't be embarrassed about what we're fighting for in the Democratic caucus in Congress right now. This is not acceptable for the wealthiest country in the history of this planet. So I'll stop there and get off my Jesuit-inspired pulpit. But I want to tell you, Jim, whatever I can do to be helpful, we've got to fight to make this different. And the inequality that COVID has continued and the tax cuts that the Trump administration did to continue this inequality, we've got to fight like hell to make sure that we counteract that. So I'll leave it at that, but thank you for letting me vent. This has been very inspiring. Can't wait to get back to work.
We always love to hear you. So thank you. Appreciate it. Ms. Scanlon.
Thank you, Chairman McGovern, for convening this great discussion, and thank you to all of our witnesses for being here. Before coming to Congress, I was pro bono counsel for a large national firm. So I worked with a lot of legal services agencies. And one of the things that we used to try to do when we would be bringing in these corporate lawyers who were very, very smart, but had no idea what the issues their pro bono clients would be dealing with, we would do this poverty simulation. And I suspect that several of you on this panel have done this, but just it was always so interesting to see, the light bulb go on as people confronted the fact that they would be, representing clients who were going to be choosing between food, between housing, between medication, and that there just was not enough money to go around. So, and how the intersection of all those issues would then determine choices that someone who was comfortable and could, scrimp and save or manage to put together enough to pay all the bills, maybe just in a different order, how they would make very different choices. And so I think it's an important discussion to be having, how all these things play off against each other. And the other thing that struck me, this was, I guess about a year ago, there was an op-ed in the Philadelphia Inquirer written by a pediatrician from one of our children's hospitals. And he was talking about the fact that a friend had asked him what one thing would do the most to improve the health of the children he saw at this children's hospital. He said, raise the minimum wage. Because again, all of these issues are intersectional, and if the kid doesn't have stable housing, then that leads to health outcomes, which leads to education outcomes. And it all just comes together. So being able to provide, whether through the minimum wage, through the child tax credit, through some combination of different supports, we clearly have to do better, because, otherwise it's just poking on the marshmallow in one place and seeing it come out someplace else. So thank you for the insights that all of our witnesses today have been talking about. I wanted to talk a minute to Mr. Johnson. I'm very, very pleased that you were talking about the Driving for Opportunity Act, because I'm one of the House co-sponsors. And we certainly know what a difference it makes. Can you just talk a little bit more about how fines and fees could relate closely to food insecurity, and how getting rid of fines and fees that or getting rid of license suspension for fines and fees could impact food security?
Yes, thank you. And thank you for your support of that act. We think it's so important. As we litigated that issue and worked through those issues of license suspension in Mississippi, we came to recognize how deeply it impacted people's lives, and how people were afraid to get in their car and go about their lives, because in many of our small towns, Congresswoman Scanlon, the police officers recognize your car. They recognize which Toyota Camry is yours, and they know Cliff's not supposed to be out here driving, and I'm going to stop him again. And so we would see situations where people would have 5 and 10 and 15 driving without a license tickets. As I said in my testimony, it's $750 a throw, right? So you just get buried deeper into debt over something, again, that ignores the realities of how we live. And in this, the most religious state in America, and having and being a child of the church, I would make the point that, if you can't go visit your mama and you can't go to church on Sunday morning, are we who we say we are? and what we want to be. So when I think about fines and fees and this impact on food, it's not always the most obvious connection. So I was so pleased to have been asked. What we learned as we were going into these courtrooms, misdemeanor court after misdemeanor court, things that were pretty remarkable. One was just the amount of the fines. They're big, right? And so when you look at that Federal Reserve study that says that 40% of Americans can't scrape together $400, again, this notion of ignoring the reality of how people live, because they've got to pay these high energy bills and housing bills and healthcare bills, and you're trying to hold it together. And Miranda talked about how these challenges, you just kind of make as you make, make do as you can, and choose among very, several really bad options. We're handing out fines, spending zero time. Congresswoman Scanlon, our judge, we're not seeing any judges in the courts we were in undertaking any analysis of how are you doing? Are you working? What's your source of income? And then saying, I can fine up to $500. I'm going to fine you $50. And the president of the bank might pay $500, right? But I'm not going to make you pay the same $500 because that's not just, right? If the goal is to punish and deter, right? The notion that everybody pays the same is not just. It hurts some people more. And ignoring that reality, I think has grave consequences. The other thing, I concluded my remarks with this notion that the threat that courts have, right? So everybody's trying to make the decision, like, which bill goes unpaid. I mean, I know there are risks with each of them. I can have my water turned off, my electricity turned off, my heat turned off. But then there's this person over here that says, I'm going to lock you up. I'm going to take your driver's license. I'm going to intercept your tax refund, right? And so it's a much scarier situation. Even if some of those things they're talking about doing are illegal, people take those threats very seriously. And so they do pay those fines and fees in certain instances, or what they can toward them. And then all kinds of other bills go unpaid, and decisions are made not to go to the grocery store, not to eat healthy, not to do the other things you need to do. So it was I was not aware of it. I mean, I've practiced law in Mississippi for 30 years now. I was not aware of just how draconian, rough this system is and how many people it affected, but I am now.
Yeah, I'm familiar with it from the Philadelphia court system, and it gets a snowball effect as well, because if you don't pay the fine, then there's additional fines and there's interest and all kinds of things tack on, and you just can't get out from under it.
And then you quit going to court because you're afraid to go back because this bad thing's going to happen, and you have a warrant issued for your arrest for failure to appear. And then we all know that if you spend just 2 or 3 days in jail, you lose your job, you lose your housing, you lose your car, you get behind on child support, and we can't minimize just a few days in jail. It's a very big deal.
Congresswoman?
Yes.
I'm sorry. Can I add something to that?
Sure.
Please, I apologize for interrupting. I can't see, so I mean no disrespect. To add to what Mr. Johnson said, that bleeds over into public transit also. Okay, how many millions of dollars are transit agencies paying to have off-duty officers or officers on the bus to catch somebody not paying a $1.50, okay, or these kinds of things? And then when you get that ticket, and then you get 2 or 3 more, just like Mr. Johnson said, now all of a sudden, because you couldn't pay for public transit, you've got a warrant out, and then I'm glad he brought it up. Then all of a sudden you lose your job. I mean, it's ridiculous that transit agencies are doing that and spending that kind of money. It actually cost me almost $1 million just to collect the revenue, right? You count it, fare boxes, all that other stuff. Not to mention, I would much rather pay, like I told the panel before you got on, ma'am, I'd much rather pay and have safety net providers like the Homeless Services Coalition and other put resources on my vehicles to be able to help people, rather than paying that money for officers to write a ticket for not paying $1.50.
Sure. And I mean, it creates this perverse disincentive if we say we want people to go out and work and support their families and feed their families and everything, and then we're taking away their ability to do it. Just one more quick question, Ms. Sadian. I've got a housing development in my district, the Chester Housing Authority. I think it's the largest public housing development in our Commonwealth. And for the last few years, the Ruth Bennett Community Farm has been operating at this housing authority. And it provides fresh, affordable food. It also provides some jobs, some internships for teens in a community that's been a food desert for a long time. Have you seen other successful collaborations with community gardens and affordable housing? And why are they important?
Yeah, there's a lot of great examples from affordable housing providers who are working in partnership with other organizations to bring neighborhood gardens, farmers markets, fresh food programs. Many housing organizations are working across sectors with food security organizations to try to cross that divide and work across silos to address those issues. It's incredibly important. But what we hear from our partners is that, to Miranda's point earlier, a lot of that is trying to tweak around the edges because there aren't enough resources or attention or policies that are getting at the root causes. And I'd love to just spend a second, you mentioned raising the minimum wage. We couldn't agree with you more. That's critically needed. But what we found is that these problems go way up the income, more up the income spectrum. From our estimates, you need on average about $50,000 a year or $24 an hour in order to afford a modest two-bedroom apartment. That's the national housing wage. So it's not just minimum wage workers, and even in places where they've had the fight for 15 and they've increased the minimum wage to $15 an hour, there's still enormous housing challenges. And part of this is because there is a systemic economic issue at heart. If you look at the 20 largest occupations, more than half of them don't pay enough to afford a one-bedroom or two-bedroom apartment. So this is a structural market issue that goes beyond the minimum wage, although we support increasing the minimum wage as well. And it's important that Congress is really looking at those root causes of why households are challenging, finding challenges with their housing.
Okay, thank you. With that, I yield back. Thank you to all our witnesses.
So thank you very much.
I could add something.
Sure.
Yeah.
I apologize for interrupting. So I did want to speak briefly. So there's a community in Michigan that we've looked at several times that it's a low income housing authority for a Hmong community, or has a larger Hmong community, and they've built a community garden out there that's specific to the dietary restrictions that are faced by Hmong individuals. And I don't know enough about the community to speak to that, but I do also think that that's something that has been left out of this conversation, or the various either medically necessary dietary restrictions or religious dietary restrictions that also come along with food insecurity. In addition, when we talk about housing and community gardens, I mean, it's wonderful. The access to produce is so important. Absolutely. But only, we could teach class after class through research and extension about how to prepare an eggplant or whatever. But if if individuals don't have cooking appliances, such as been mentioned, there were many times where, we ended up staying in a hotel that only had a microwave, and, there are only so many things you can do with an eggplant in a microwave. So, and honestly, if you're experiencing poverty, getting, if we're being honest, nutrients, I didn't know the first thing about nutrition until I was in college, because that is the last thing on your mind. At that point in time, it's just, what can I do to stave away from the feeling in my gut? So there are also cases, if we want to talk about, community garden partnerships, we have a couple of cases in Kansas where the community garden supplements the food pantry locally. So we have, especially during the pandemic, that was extremely important. But again, I think, when we're talking about housing, it's also making sure that they have all of the, the regular appliances, making sure that they have pans to cook with, making sure that there are safe knives and that, they're in a safe enough space where not having knives in the house is an okay thing, et cetera. So, yeah, I'll stop there. Thanks.
Okay.
Thank you.
Thank you all.
No, and look, that last point is important and often doesn't get discussed here in Congress. When I was in San Francisco a few weeks ago and at an event where they were passing out fresh produce to people, and there was a lot of fresh produce and a lot of people, again, who lived in apartments with no refrigeration, no kitchens. And so, yeah, the fresh produce is great, but if you can't, it goes bad, right? So we have to understand people's realities and figure out how to, there's an infrastructure part of this. So I've been called to a leadership meeting on reconciliation. So I'm gonna submit some questions in writing, but I want to just let me just pose this last question, give everybody a chance to say what they need to say. And I'll be a few minutes late for this, but I have a feeling it's gonna be a long meeting anyway. But Ms. Miller Kluger, as you lived the story that I hope that this hearing is laying out. It's hard to struggle. It's hard to be poor in America. Families face a series of complex issues with limited and often not great choices in front of you. And on top of everything else, families without financial security, all the stuff that they endure, they face decision fatigue, right? I mean, and if you can just talk to us a little bit about decision fatigue, what it is and the role it plays in hunger. And then to the panel, as a way of summing everything up, each of you is representing a significant cost to a family each month. Prioritizing, balancing, borrowing, trade-offs. Families face these issues and they have to make choices based on a lot of bad options every single day. What are some of the strategies families use to pay bills, and how does this lead to decision fatigue? And we'll just go around. Ms. Miller, Klugaser, we'll begin with you, and then we'll do this is like Hollywood Squares, but every time someone speaks, everybody moves, and so we'll start with you, and then we'll go around.
Great. Yeah. Thanks for bringing that up. It's one of those things you want to talk about and you just don't have enough time. So I have to apologize. I don't know the name of the scholar off the top of my head who coined the term decision fatigue, but the concept is basically, it so eloquently sums up what we've talked about today. So all of these various intervening variables that impact a family's ability to secure food and to feed themselves on a daily basis, those are all decisions that for the average middle-class person, and I can say this now being, what I would consider to be a middle-class person, having moved out of the mindset of someone who is experiencing the stress and trauma that is, the everyday poverty, that you look at decisions completely differently. And I think that the concept of decision fatigue is this idea that you have so many things you have to decide upon, and so sorry, the Airbnb dog is here. So you have so many things you have to decide upon every single day. Which bill do you pay? What is most important? And on top of that, how do I get my kid to childcare? Can I pick up an extra shift at work? All of the things that for an average upper middle class individual, these decisions are nothing. That's just part of living life. But when you're also living under the veil of extreme stress and poverty, in our case, it was, is the bail bondsman going to show up and bang on the door, or am I going to be pulled over because I don't have car insurance? It's all of these other things that are weighing so heavily on you. And on top of that, you have so many poor decisions in front of you. None of the decisions that you have to make are great or good. And oftentimes I think when we talk about the kind of disruptive narrative is this idea that, well, if you just made better decisions. I can't tell you how many times I've heard that. And honestly, but I didn't have a good decision to make. I made the best decision of the really crappy decisions that were in front of me. And such as, when the representative was talking about this poverty simulator, I think that's the best way you can possibly do it. And that's the best way to capture this image of, I am so tired of making all of these other hard decisions here, eat ramen again. Like, again, it's, what you're going to eat, nutrition, all of these things. That is the last thing on anybody's mind when they're facing all of the other things that these folks have talked about today. And I think that perfectly kind of sums up the issue that, when you're faced with all of these bills and all of this other stress, food, last thing on your mind. And at the end of the day, it's just what you need to sustain you to get through another horribly stressful day. And I think that's what decision fatigue comes down to is, how do you make all of these other decisions, and ignore food? That is the consequence. So I hope that answers your question.
It did. Thank you very much, Ms. Sadian.
Yeah, well, what we found is with the lowest income people, they do everything that they can in order to be able to pay their monthly rent because, as Matthew Desmond has said, rent eats first, even if that's taking up 50, 60, 70% of their income. Other things that we've seen households do is double and triple up with other households, put their rent on their credit card, secure debt, borrow money from friends, but oftentimes cut their healthcare costs, cut their food costs, but many times it's not enough. It only takes a couple $100s for people to face eviction, a very small amount of money, and then that in turn pushes them deeper into poverty, into higher crime communities, higher poverty communities, where there are even fewer resources for them and less access to healthcare and economic opportunities. So what you see is this long-term consequence that follows families and children throughout their lifetime because we're not catching that housing insecurity and food insecurity really enough.
Thank you. Mr. Mackinnon.
Mr. Chairman, public transit is that one thing, okay? And what public transit should do, like I said earlier, is weave itself into the community fabric. Everything everybody's talking about right now and has today, public transit affects, okay? And if we can just come to the realization that public transit should be infrastructure, it's a part of infrastructure, and taking that decision fatigue off the fact that, well, am I going to be able to, how do I get to work? Am I have to call somebody, or how am I going to get access to get to healthcare, to get to whatever? Take that off of somebody's plate to where they can just get on public transit and be able to access the region and be able to break down those barriers and get wherever they would need to go. Makes a difference in people's lives. And I'll, thank you very much, sir. I appreciate everything I've heard from you and this panel. We shouldn't run away from the people that need us the most. We should run toward them.
Thank you.
Thank
Mr.
you.
Barber. Thank you, Mr. Barber.
Yes, sir, Mr. Chairman. Thank you for this opportunity. Again, the troubling reality is that when we talk about energy burden, it exacerbates so much of what has been discussed today. Again, the dilemma of heat or eat. There was a 2012 study that showed that the number one reason that families would take out payday loans was to pay their utility bills. That was in 2012, number one reason. And of course, that led to a number of, poverty trapping realities where that family continues to get locked into this situation of poverty. We've seen other mechanisms where families try to cope by either not heating their homes adequately or resorting to very potentially detrimental, potentially dangerous methods of heating or trying to maintain that homeostasis in the homes. And that, of course, has its own set of healthcare costs and risks that are associated, because we know that being exposed, adolescents who are exposed to homes that are not adequately heated or maintained doubles the risk of respiratory problems. So exacerbating that pathway for not only the increased energy burden, but that pathway for increased healthcare costs. So everything we're talking about today, I'm so appreciative of you all looking at the holistic piece, but it's very much a piece where energy sits at the center of that web of poverty and really has to be seen as a critical factor. Thank you.
Thank you, Mr. Johnson.
Thank you, Mr. Chairman. I would say from the criminal justice fines and fees perspective, it's important to recognize that people don't want to owe this money. This isn't about getting over on the system or getting away with something. It's hard. And so when you make that tough decision that, okay, this month I've got to pay rent and I've got to pay this doctor bill because they're not going to see me again if I don't pay my bill. Now you live in fear of being stopped for anything, right? Having a tail light out, driving a little too fast, driving in the wrong neighborhood, and you get stopped and the trouble begins anew. I think the challenge here is deciding whether we are who we say we are. You know, we talk a good game about having a special commitment to the poor. And do we believe that this is something that can happen in the US, or is this something that only happens in places like Sweden or the Netherlands? And I believe that it's a matter of values. It's a matter of values, and it's a matter of personal and political will. And on that front, Mr. Chairman, I do want to thank you. In preparing for this, I've gone back to look at your record on this, and you're not new to this, and you have shown a commitment to this for a very long time, and I'm inspired by it, and I appreciate it very much. And thank you for the opportunity to be with you.
Thank you very much. And Dr. Michner, you get the last word.
All right. And, you know, I want to build directly off what Mr. Johnson just said, because he said it's a matter of values. But then the other thing that he mentioned was that it's a matter of political will. And I would add another really important word to this mix and say fundamentally what we're grappling with here today are questions of power, right? So we were talking about decision fatigue. Decision fatigue for people who are facing these kinds of circumstances essentially comes from having to fight for your basic existence, for your human dignity to be recognized as having value and importance. It means that your lived experiences are not visible to people who are in power. And so they can think about these things in the various ways that we've talked about, are sort of wrong-headed to think about, or they can not think about it at all. They can just say, oh, okay, some more money for SNAP, and not think about the holistic picture that we've been weaving throughout this panel, or think about it in ways that don't quite map on to what it means to be living in rural America or living in urban America, or being a person of color facing various forms of racism in these different systems we've been talking about. When people who have power don't understand the nature of these circumstances and experiences, they can make policies that are harmful or oppose policies that are helpful. And so that at the crux of all of this is power. And I guess one thing I'd say about how people cope with this is that we've talked about a lot of the difficult decisions that people have to make and the sort of beg, borrow, steal decisions that many people are facing, irrespective of what kinds of lives they prefer to be living. And all of that is very true. But I guess one note I'd leave us on is I also study how and when people respond by trying to channel their political voice, trying to build power, trying to speak up, to vote in ways or engage in ways, become a part of civic and political movements, and take action to try to fight back against some of these, what we've honestly been talking about, are injustices. Now, that's really hard when you face all of these very difficult decisions and these cumulative disadvantages. So on top of everything else that all of these different things that we've been talking about implies, it also implies that our democracy is weaker because of these realities, right? That the voices, the influence, the perspectives, the power of people who ought to be able to have an influence over processes so that we don't get these kinds of outcomes are weaker than they ought to be. And I think that's a dimension of this that I wanted to leave us thinking about and cognizant of. Thank you for having us here and for gathering this wonderful panel, Chairman.
Well, thank you, because this really was a wonderful panel, and it's very, very helpful. And again, as I said at the beginning, I mean, my intention is to, as we develop this White House conference, to reach back out to you to help plan the various aspects of this conference. Look, I tell people all the time that hunger is a political condition. I mean, we have the food, we have, all the things you talk about, housing, the transportation, we have everything there. Right? It's whether we have the political will, as many of you have said, to actually take this issue on. It is a great injustice, that we live in a country with so many people who don't know where the next meal is going to come from. And those people don't fall into one nice, neat category. It's very complicated. And to solve the problem, again, it's not just about food, right? It's housing, it's transportation, it's a justice system that truly is just. It's all these things and more. And so I'm hoping that the preliminary discussions that we've had with the White House, which have been encouraging, actually lead to a concrete action. I'll just tell you one thing. The last time we had a White House conference on this topic was 52 years ago. Actually, Richard Nixon was president. My last name's McGovern. I don't know. I'm saying something semi-nice about Nixon, but the deal is that out of that conference came WIC, came the modern day SNAP program, which used to be food stamp, a greater appreciation about improving child nutrition programs. So good things came out of it. What we want to emphasize in this next White House conference is that in addition to listening to all the experts, which are important, right? We need to listen to people with lived experiences. As we were talking before, when I'm thinking of getting people fresh produce, as opposed to, less healthy food, people who are food insecure, I don't think I really appreciated the fact that so many people who live in apartments don't have kitchens or don't have adequate refrigeration. Shame on me for not knowing that, but I learned that from talking to people, who are living that. And I think that's, incredibly important as we proceed here. So there will be follow-up questions, and hopefully, we're going to reach out to you as we plan this conference. But you've been incredible, and Ms. Miller, Klugaser, I think on behalf of all of us, we wish you a good rest of your honeymoon. And thank you for joining us here today. And with that, the Rules Committee will be adjourned. All the best. Be safe.